let's get started. So the lower extremity will follow a lot of the principles we described for the upper extremity, as far as the types of actions possible at the joints, flexion, extension, and so forth, as well as the various compartments that we're going to talk about that are sort of separated functionally, not just structurally, right? As we'll see, the thigh, for example, is divided into three compartments. There's the anterior compartment, which extends at the knee. So the anterior compartment is everything going from the thigh anteriorly, inserting across the patella onto the tibia, okay? And so collectively, these muscles that we'll talk about, the quadriceps mainly, will act to extend the knee. We talked about how the origin is closer to the source of the muscle, and then the insertion is going to be further away, but the muscle pulls from the origin toward, from the insertion towards the origin. So that brings about extension at the knee, and it can also help with flexion at the hip, which we'll talk about. The second compartment of the thigh is the medial compartment. This is kind of on the medial aspect of the leg, the thigh. And these muscles are going to adduct at the hip. So they help to bring the thighs together. And collectively, we'll talk about different muscles, but their action is one. And the posterior compartment are going to be the opposite at the knee joint. They're going to flex the knee. This is your hamstrings, again, separately named muscles, but they have a collective action to flex or close the knee joint posteriorly. All right, so we'll see that theme kind of follow. Muscles grouped together have a similar function and are separated by a connective tissue so that they're in a separate compartment. Let's start with the sartorius. Sartorius is the longest muscle in the body. This is sometimes called the tailor's muscle because it actually helps you to flex at the hip and extend at the knee. And if you look at a tailor's, the old-time tailors would sit with their legs across their other legs, so kind of their legs crossed, and both of those actions are required to do that. Flexion at the hip, extension at the knee. So this is a long sort of oblique muscle running from the iliac crest laterally to the tibia medially, and it helps to flex and extend, so acting at both joints. Then we have the iliopsoas. Iliopsoas is really a combination of two smaller muscles in the hip. The psoas muscle, so here we have psoas major, psoas minor, which is much smaller, more tendinous, and then the iliacus. Iliacus is sitting in the iliac crest, in the iliac fossa. And so together, distally, both of these muscles are joined to form one common tendinous insertion on the lesser trochanter, and together the distal part is the iliopsoas. So because this crosses over into the thigh, it's going to help to flex the thigh. And so that's going to be really important. Flexion of the hip, flexing of the thigh, and that will be kind of the main muscle here. But think about it as two muscles in the abdomen and pelvis, and then one muscle in the limb itself, in the thigh. Moving on to tensor fascia latae. Tensor fascia latae is a thick connective tissue band. It's mostly connective tissue and tendon. It's also called the iliotibial tract or the iliotibial band, or sometimes the IT band. So it starts up here again at the iliac crest, it goes all the way down. Some of its fibers actually blend with the gluteus maximus, which is the large muscle of the gluteal region. And then it continues down like a band to insert on the lateral tibia. And so this, again, mostly tendon, but it does help, especially the proximal part, to flex at the hip along with iliopsoas. All right. Now the tensor fascia latae is going to be the muscular part, very small proximal portion, and the IT band is going to be the rest of that, more connective tissue, more tendon inserting onto the tibia. Next is our main bulk of muscles in the anterior compartment. This is the quadriceps femoris, commonly known as your quads. And because of it being four bulky, powerful muscles that start at the hip, okay, so these don't necessarily act across the hip because they don't cross the hip joint. They start at the hip, beginning at their insertion on the femur itself, and then going all the way down. And so the only joint that they cross is the knee. So their action is going to be mainly across the knee, which is extension of the knee. Now they're going to form this common insertion via the quadriceps tendon. So all four muscles come together to make a common tendon, which invests the patella first. Now it becomes the patella tendon and then inserts onto the tibia. So here's where anatomists get very particular, very dicey. The proximal part of this is the quadriceps tendon. The distal part of this is the patella tendon. So same structure, just different name according to the different parts. All right. Let's go to the neurovascular structures of the thigh, starting with the femoral structures. So in this triangle, we call this the femoral triangle, and it's created by some of the muscles that we'll talk about going down into the thigh, such as the iliopsoas. We already talked about iliopsoas, and then pectineus. Pectineus is one of the deeper thigh muscles. And so together, iliopsoas, pectineus, they form this bed, right? This triangular bed that has the neurovascular structures within it. And going from medial to lateral, the mnemonic here is VAN, always in that order, from medial to lateral, the femoral vein, femoral artery in the middle, and femoral nerve most lateral. All right. We also want to think about the tributaries, the veins that are dumping into the femoral vein. One example of that is the saphenous vein. And saphenous vein is going to collect all of the superficial drainage of the extremity and bring that up to dump into the femoral vein. And then that goes back into your iliacs and eventually back into your inferior vena cava. As far as the artery, the branch from the femoral artery here is the deep artery of the thigh, also called the profunda femoris artery. Kind of like the deep artery of the forearm that we talked about, which is a branch of the axial artery. So the deep femoral artery or the profunda femoral artery is going to travel deep into the thigh. You can see it branching here. So here's femoral. And before we get into that, I kind of want to talk about how the femorals form. So when they cross this ligament, the inguinal ligament, the name here changes. Instead of being the external iliac artery and external iliac vein, when they cross the inguinal ligament, they now become the femoral vessels. And then the femoral artery specifically branches to give the deep femoral artery to the thigh, and that will supply most of the thigh, the deep aspects of the thigh, and the back of the thigh as well. Okay, let's look at the medial compartment. Sorry. So the medial compartment is going to be including, we talked about pectineus. So pectineus is the most superior muscle, again, forming that bed for the neurovascular structures. Then we have the three adductors. The adductors are adductor longus. Then we have adductor brevis. You can see a little peak of adductor brevis. It's a much shorter, smaller muscle. Again, brevis means short. Here's a much better view of that now that we've taken off some of the quadriceps muscles and sartorius. Then we have adductor longus and adductor magnus. Adductor magnus being this much bigger muscle behind the adductor longus. So pectineus, adductor brevis, again, very short, very small muscle in between pectineus and adductor longus. And then behind all of these, the much bigger muscle being the adductor magnus. Now, adductor magnus also has this opening in it, the adductor hiatus. And the reason this is important is because the femoral vessels come through the thigh, and the femoral artery and vein are going to pass through this hiatus, and they're going to end up on the back side of the thigh. They're going to end up on the posterior aspect of the thigh and emerge through the popliteal fossa. This is where the name will change again. So again, two important landmarks where the same vessel is coursing and the name changes. So as it passes through the adductor hiatus, it goes from being the femoral artery and vein to the popliteal artery and vein. And we'll talk about those when we get to the knee. So adductor magnus, the deepest of the three, the largest of the three, and it has that hiatus for the vessels, okay? It's gonna be a powerful adductor of the thigh. It's actually gonna be dual innervated, but you guys don't have to worry about the innervation, but both the sciatic and the tibial nerve will innervate the magnus. Now we get to the pectineus. Again, a very smaller muscle helping to form that femoral triangle above adductor longus and then covering up most of adductor brevis. So here's pectineus alone, and then here's just the reference position of adductor longus. Then we have gracilis. So gracilis is the medial most muscle. It's another strap muscle, just like the sartorius. So it goes from the pubic symphysis, right, the pubic bone, all the way down to the medial aspect of the tibia. And so it's going to be a long strap muscle that also helps with adduction of the thigh. Okay, let's move down into the leg and talk about some of the compartments and muscles. Now, we similarly have 3 compartments in the leg. However, it's not the same 3 that we have in the thigh. Here we have an anterior, posterior, and a lateral, right? In the thigh, we had no lateral, we had a medial. In the leg, we have no medial, we have a lateral. So we have 3 compartments with 3 different groups of muscles, and we'll talk about different nerves and arteries that supply these compartments as well. So the anterior leg, which is the front of the leg, this is going to help with the dorsiflexion at the ankle. This is toes going up, right? Imagine standing on your heels and allowing your toes to go up in the air. That is dorsiflexion and the action brought about by the anterior muscles. Then we have the lateral compartment. This helps with eversion of the ankle, so bringing the lateral aspect of the foot outward. And then we have posterior, all the back muscles. Sorry, these are going to help with plantar flexion, so toes going down, standing on your toes, kind of like a ballerina, heels off the ground, and those are the actions brought about by the posterior compartment muscles. Now, let's start with the anterior compartment. We have muscles that are very close to the tibia. So the tibia is one of the examples or rare instances in the body where the bone comes very close to the skin. There's not very much musculature covering up the anterior aspect of the tibia, and you can palpate this on yourself. Very close under the skin, we can palpate the tibia bone. And so we're going to have muscles on either side of that exposed tibia, which are going to help with the anterior action. Another important thing to remember here is their insertion is going to be down on the metatarsals. So when you look at all of these anterior muscles, they are going to cross the ankle joint and insert onto the metatarsals. Therefore, that will help explain their action of lifting the toes off the ground, right? We have the tibialis anterior being the main one of that, the powerhouse of the dorsiflexors. Deep between the tibialis anterior, we have the extensor digitorum longus. So here's extensor digitorum longus. And notice how, because this has the word digitorum in it, it's going to the 4 lateral digits. You can see the tendons splitting off, one common muscle, but the tendons splitting off to insert separately onto the 4 phalanx. Then we have extensor hallucis longus nestled kind of in between those 2 tendons. So here's tibialis anterior, here's the extensor digitorum longus, and then in between extensor hallucis longus. And notice how the tendon of this goes only to the great toe as the dorsiflexor of the toe only and not of the other digits. Okay, let's talk about extensor digitorum longus and fibularis tertius. Okay, now extensor digitorum longus, we kind of talked about it earlier here, one common tendon. This is in between the lateral compartment. So the fibularis longus, which is the lateral most muscle of the leg, is actually part of the lateral compartment. This is not a part of the anterior. So that can be a little bit confusing when you look at the leg straight forward and you can see a bit of fibularis longus, right? So the extensor digitorum longus is in between fibularis longus and then the extensor hallucis longus. And then we also have the fibularis tertius, which is smaller and on the foot. This comes off of the tendons of extensor digitorum longus, much shorter, inserting onto the 5th metatarsal, and will also help to bring about its, complete action, which is dorsiflexion. So together, all of these muscles that we've just listed, tibialis anterior, extensor hallucis longus to the great toe, extensor digitorum longus to the lateral digits, and then our fibularis tertius are all anterior muscles that help dorsiflex. In terms of the neurovascular structures of the anterior compartment, we have the anterior tibial artery and the deep fibular nerve. Now we will speak about the branches that give off these, or the artery and vein, the artery and nerve that give off these two branches when you look at that schematic overall. But the anterior tibial artery, is a branch of the popliteal artery that will then pass through the interosseous membrane of the leg and supply the anterior compartment. Similarly, the deep fibular nerve, you can see it running down here, is also going to pass to the deep aspect of the leg and supply the anterior compartment. The deep fibular nerve is a branch of the common fibular nerve, which will then give off the deep fibular and superficial fibular that will supply different compartments. In terms of where we find these two structures, they're going to be between the tibialis anterior and the extensor hallucis longus, and they're going to be traveling from proximal to distal to supply that entire compartment, all the muscles, all the way down to give off branches that supply that part. Okay, let's look at some practice. Okay, now going back to put a bit more emphasis here on the quadriceps muscles, rectus femoris is going to be the most anterior of the four, all right? And then with rectus femoris in place, we can only see vastus medialis and vastus lateralis, right? In order to see the fourth muscle, which is vastus intermedius, we're going to have to cut away rectus femoris. So definitely look for what type of dissection you're seeing in the image. Is it a full superficial view where there's no muscles taken off? Or is it a deeper view where we can see the intermedius? So again, the rectus femoris is cut here. Now we can see vastus intermedius, vastus medialis, and vastus lateralis, all four together forming the quadriceps femoris. Okay, so in that question we just looked at, the vastus intermedius is going to be that deeper muscle that's exposed, which was the answer there. And then the right side was correct.